You're listening to Adayulogues, where we have conversations about mental health. A lot of time teenagers come to me and they ask, am I feeling sad or is it depression? There are frequent crying spells I feel. A lot of times I'm just crying without any reason. Am I doing this to seek attention? Or they would also ask that I've started to lose interest into things which I used to like earlier. Am I getting lazy? Or if this is a problem, then does talking really help? So today we will ask Dr. Parikh, what is depression?
Sadness is an emotion. We all can occasionally feel sad. Things not going my way, it can make me feel low. That is not depression. It's true that we use the word depression sometimes very loosely. Hey, I'm feeling depressed. Hey, you are looking depressed. To be honest, we should avoid using depression like this. Because depression is an illness. It's a medical illness. Whereas sadness is an emotion we will experience. Sadness as an emotion will come and go away. It will be reactive to what we are experiencing. Whereas depression, the same sadness, will continue for almost 2 weeks or so. I may also feel irritable. I may not want to talk to my friends. It may affect my studies, my concentration. I may feel tired, fatigued. My sleep gets impacted. My appetite, weight may get impacted. I may feel low about myself consistently. I feel helpless. At times I may feel hopeless. I may not enjoy life anymore. If this is happening consistently for, let's say, 2 weeks, yes, this could be depression, and depression is a medical illness, not your fault, not your weakness, not something that is about you. It's not because there is some stress in your life. Depression is a medical illness. Globally, around 300 million people suffer from depression. Neurotransmitter imbalances, some other biological factors, some psychological factors, especially the way we think, cognition, environmental aspects. All of these have a role to play in the cause of depression, and that's how treatment also happens, which means you help with the environmental aspect. You also bring in the support systems, whether it is school, friends, family. You look at the therapeutic aspect, wherein you'll get the counseling from an expert, cognitive behavioral therapy, dialectical behavioral therapy, social skills training. Some of these techniques are very useful. And yes, if need be, based on the severity of the condition, you may be asked to take medications. Medications are not sedatives. They will not be taken lifelong. They will not affect your daily functionality. But what is important is that you don't hesitate to seek help. A lot of times, teenagers struggle in their silence. They feel people will not understand me, adults will not understand me. Whom do I go and talk to? There are times that we've heard people making fun of others, mocking others, and that does have an impact. So that makes a teen hesitant that will I also be treated like this? Will they make fun of me? Will they call me it's my fault, my weakness, laziness? All of that you put aside. If you are struggling, you talk to someone. You go talk to your parents, talk to a friend, counselor, teacher, but you talk to someone and don't hesitate to seek help. You do not need to struggle in silences. Having said that, this is also something for all of us to reflect upon. Use words with responsibility. Bring that psychological sophistication and sensitivity in our social interactions. Don't use words loosely. Don't mock at people who are struggling. Because a word that you say here may have an impact on someone somewhere else. We are all equally responsible, and we all need to understand when it comes to our mental health, we all have a role to play. If we create a nurturing environment, a psychological safe environment, if we understand the importance of psychological first aid, if we all become advocates and responsible around mental health, we can collectively fight depression. You're listening to Adayulogues, where we have conversations around mental health.